Welcome to Law 100 and how the money fairy is disappearing our contribution to achieve a proper healthcare system. In Colombia, there is a functional problem regarding the healthcare system. It is important to understand what the factors responsible for this malfunction, which can be held responsible in the belief that the healthcare system in Colombia is based in a regulation market that considers health as a business instead of a fundamental right. In consequence, during this video, I will try to explain how the healthcare system works, its problematics, and how to tackle them in order to find a way in which the whole nation can be covered by timely, quality, and effective system. Administratively speaking, in Colombia, healthcare system responsibility has been transferred to the department and municipalities that were recognized by the nation before. There are many laws that have influenced to this transition, since the Article 48 to 49 of the Constitution of 1991, where the private health was first recognized as an irrefutable basic need of each citizen, to the statutory of 2015, which brought different benefits for citizens. One of them, the recognition of health care as a fundamental right from which health entities couldn't refuse to offer. But most importantly, Law 100, who structured the current health system directed by four principalities: the privatization, decentralization, subsidies to demand, and lastly, identification processes. This system is divided into two regimes: the régimen contributivo and régimen subsidiado. The first one is through established amount of money that one has to pay depending on the salary to acquire the healthcare system services. The second régimen, which is the régimen subsidiado, is taught towards the less favored class which can't afford healthcare due to their low incomes. In order for this regime to function, the UPC of the people who make part of it's financed by the UPC of the people who make part of it, it's financed by the people from the régimen contributivo, as well as the contributions made by the government that are distributed in the FOSIGA, which is the Fondo of Solidaridad y Garantía, who is in charge of compensating for social security and health between the people in the different social status. According to Oscar Rodriguez Salazar, the sources from which both regimens are financed is firstly, for the régimen contributivo, there exists an employer-employee system which consists on the system where the person who wants to affiliate to the healthcare system has to establish has established prices to access it. Meanwhile, the régimen subsidiado is financed by solidarity resources, local powers, and government budgets. The objective of these structural reforms has to create an economical growth in 10 years, such as the régimen subsidiado would significantly smaller than the régimen contributivo, but it didn't. The reforms that formed the free competition among EPSs didn't give it expected results, and nowadays the actual contribution to both regimens is of the 50% affiliations. Furthermore, the entities proposed in Law 100 created a vertical integration which talked about the EPSs being the owners of the IPSs. This relation between the two healthcare entities implied a decrease in the system's quality due to the reduction in costs and delay and denial of services. On the other hand, neoliberalism being a theory of political economic practices, the human well-being can be advanced by liberating individuals' entrepreneurial freedoms and skills. According to Thorsen, allows each individual to manage and administrate their entities individually without intervention from the government. But we may mention that the healthcare system isn't completely neoliberal. Great influence from the state involved a function of the healthcare system. Still, the government in influence over the operative way the system works. This involvement from the government is called the welfare state, defined as a social system based on the assumption by political states of primary responsibility and for the individual and social welfare citizens of its citizens, according to Webster. It's already mentioned. Law 100 stated that the healthcare system would be implied into a neoliberal way, which meant a change in the responsibility of the welfare state to a private entity such as EPS and IPS. This situation has consequences in several aspects in Colombian lives. Firstly, economically, by maintaining the neoliberal models that manage the healthcare system, the owners of these private entities are going to seek for the retention of more capitals each time. That will leave a bigger economic and financial gap each time. Second, political people will be unhappy with the quality and efficiency of the system that will create a generalized claim towards the government because of the poor quality of the healthcare system. Third, culturally experiencing the proliferation of cartels such as Cartel de la Hemophilia and Cartel de las EPS, whose goal is to manage jointly and deliberating for increasing illicitly profits in the determined area. Lastly, environmental, due to the lack of services towards disease, this can expand virally and creating a new epidemic, increasing mortality in children. The change proposals to tackle this problematic are to diminish substantive inequality between rich and poor and among urban and rural zones, defining a strategic framework, establishing a 10-year plan on a public health goal, and on operative framework, there are three operative lines: the primary health attention, community and family health, risk management in health, and a differential and populational context, and changing the neoliberal model to a centralized income model where there are received health care and anti-corruption supervision in the government by the government.